Hi, I'm Hadley Wesson. I'm a general surgeon at Howard County General Hospital. Research has shown that following specific steps can help you improve your recovery after surgery. In this video, I will explain what you can expect as you prepare for surgery, on the day of your surgery, and during your recovery. Thank you for taking the time to watch this video. As soon as you know you are having surgery, talk to your doctor about preparing for it. Research shows the healthier you are before surgery, the more likely you are to have a positive experience, better outcomes, fewer, if any, complications, and a shorter stay. We focus on your overall health and medical history to make sure to eliminate or minimize any complications related to an underlying health condition. We also discuss your nutrition and hydration before surgery to make sure your body is strong and prepared. Before your surgery, we'll arrange any special care which may be needed after your surgery. This will ensure a smooth transition and plenty of support when you need it most. Whether getting help from your family members or at a rehabilitation facility, we strongly recommend that you designate one family member or friend to be with you throughout the entire process. There is a detailed process which you should follow for surgical preparation, which may include cleaning with wipes we will provide. This will help prevent infection and ensure that your procedure will move forward as planned. We will give you a checklist in advance that includes what to bring to the hospital, what to wear, where to check in, and what you can expect when you arrive at the hospital and wait for your procedure to begin. We will also let you know when and what you are permitted to eat and drink starting the day before your surgery. Staying hydrated throughout this entire experience is vital to enhancing your recovery. After surgery is completed, you'll recover in the post-operative recovery area and then be moved to a surgical unit for nursing care. Our focus will be to help lessen any pain you may have and ensure a speedy recovery by developing an effective pain relief plan. This plan minimizes narcotic pain medications and includes alternative treatments such as ice, heat, and relaxation techniques. Your nurse will help you get up and out of bed on the day of your surgery. We understand that you may be afraid to start moving so soon, but movement after surgery is an important and critical part of your recovery. Our goal is to have you out of bed for the majority of the first day following surgery. You'll be encouraged to walk in the hallway with your nurse or family members. Many precautions are taken for your safety after surgery because you are at a higher risk of falls because of pain, medications, and a new unfamiliar environment. We will provide you with non-skid socks and a call button to request help getting in and out of bed or a chair until you're steadier on your feet.
Hi, my name is Fernay Janessi. I'm a physical therapist here at Howard County General Hospital. In addition to walking, there are exercises you can do while lying in bed or sitting up in the chair to help speed your recovery. You will also have an opportunity to practice using stairs before going home. We want you to recover safely, so please don't hesitate to ask your nurse or your physical therapist for assistance at any time.
Following your procedure, we will focus on fluid intake and walking. Depending on the type of surgery, you may be able to begin on a regular diet or soft foods as tolerated. You'll be ready to go home when you are fully hydrated, your pain is well controlled, and you can move about on your own. If you are still in the hospital a few days after surgery, we want you to be as independent as possible, walking in the halls with or without assistance. If you have additional concerns, we can bring a physical therapist to assist you. We'll do our very best to help you recover with ease after surgery and get you back to normal and walking easily on your own. You may have questions about length of recovery, how much lifting is allowed, and when you can go back to work. Your doctor will give you the best answers based on your specific procedure and medical condition. You'll also get an information packet that lists warning signs of potential complications, proper wound care, bowel and urinary function, dietary guidelines, and the timing of when you can return to work or drive. Please call your doctor's office if you have any questions or concerns. Thank you for watching. We look forward to providing you with the very best care possible.